Welcome to the weekly checkup on ReachMD for the week of December 14th, 2015. This week's news segment indicates that we all might be a little hard of hearing. A recent study from the University College London found that the brain's capacity to hear and see are in direct conflict, meaning that the brain is often forced to choose between them. Unsurprisingly, in a world of increasingly accessible digital media, vision assumes a dominant role much of the time. So it turns out fully functional ears are just one piece of the hearing puzzle. We also need our brains to be tuned in as well. It's more evidence to consider that we might not be as hardwired to multitask as we once thought. ReachMD continues this month's focus on global medicine with a segment dedicated to sharing surplus medical equipment around the world. In line with the charitable sentiment of this holiday season, learn about Seeding Labs, a philanthropic group working to share surplus supplies with scientists and medical practitioners worldwide. See how you can become part of the solution. And now for a quick look at some of our latest featured content. Traumatic brain injury can be devastating for both patients and their loved ones. This life-changing event impacts an individual's lifestyle, ability to work, relationships, and even personality. Learn about these different facets of brain damage in our latest book club installment with the author of The Traumatized Brain, a family guide to understanding mood, memory, and behavior after brain injury. This week's video highlight features an interview with the first blind individual to take and pass the American Board of Internal Medicine. Hear from Dr. Fran Salerno as he discusses his remarkable journey in the field of medicine.
The week after I graduated from medical school, I had my first experience with a retinal hemorrhage, which is the result of being a type 1 diabetic since the age of 5. So I had considerable diabetic retinopathy at the time that I had this experience. I had the best treatment known at that time. I was provided care by a physician known as Paul Kenneth Nace, who had managed this disorder through retinal ablation therapy. And during the course of my internship, I started out with very usable sight. It was probably 20/30 at the time. And in a very short period of time, it progressed on rather severely. At the time that this happened, I was discouraged from progressing in the field of medicine. I think they said I should be a psychiatrist, but I wasn't quite sure. They were probably saying I should see a psychiatrist, but I didn't follow their advice, and I went and learned how to be a blind person first.
For more featured content, head to ReachMD.com or listen in on iHeartRadio, iTunes, TuneIn, or Stitcher. I'm Marshall Miller, as always, inviting you to be part of the knowledge.